Good afternoon, everybody. Afternoon, Rachel. It's 4 o'clock on Wednesday. That time we come together to remember that we're going to get through this and we're going to get through it together. I'll start by thanking everybody for allowing me to move yesterday to today. We all struggle at times through this pandemic, and admittedly, I just needed a day. But back at it, ready, and we are going to defeat this thing together. We have a light at the end of the tunnel. It's a big, bright light. It's going to take us time to get there. So continue to mask up, continue to do all those things that protect people. And as you'll see, our numbers continue to look better and better, with the exception of those that we are losing, which are a result of that dramatic increase we experienced. Let's start with good news. We need good news in our world. And let's remember, we rightfully so, we get caught up thinking all day long about the pandemic, but there's still lots of good things going on. First is worker safety. So I speak often about the importance of Kentucky's workforce, which is the backbone of the middle class, the glue that binds most of our communities together. It's also so many of you, our families, how you put food on the table. My administration is committed to providing well-paying opportunities for growth and retirements marked by dignity and security. Above all, we treat all honest work as worthwhile, and we treat our workers with respect. The hardworking folks at the Kentucky Labor Cabinet have played a major role in ensuring we're living these values during the pandemic. Most often, I talk about unemployment insurance or those who play a role in keeping us safe by investigating reports of noncompliance to the Kentucky Safer Hotline. But the Cabinet is also responsible for enforcing occupational, safe, and health standards at workplaces throughout the Commonwealth. Those are the standards that are supposed to keep us safe, that identify unsafe, hazardous, or unhealthy environments, that stop practices that pose dangers. And when companies don't live up to those standards, cite them and help them and provide them the incentive to ultimately get things right, to make sure all of our Kentuckians are safe on the job. So today, we have some really good news to share on that front. The agency just reported today that the state's recordable, non-fatal occupational injury and illness rate has fallen to the lowest point on record. The total recordable incident rate for all industries has fallen to the lowest level since the U.S. Bureau of Labor Statistics began recording the data in 1996, according to the Occupational Safety and Health Program Fiscal Year 2020 Annual Report. So for 2020, based on 2019 BLS data, we were at 3.2 cases per 100 full-time equivalent workers. For comparison, that was 8.4 in 1996. What this means is this was the safest year, even in the midst of a pandemic, to be a worker in Kentucky. It means that our labor cabinet's doing it right, but it means so many of you all are doing it right too. This is what happens when we enforce standards, when we create the right framework to ensure that our folks show up and they're productive, and they're enthusiastic, and that they are also safe. So 2020, having the lowest injury rate since it's been recorded in 1996 is some pretty good news. It means a lot more people made it home that night to their families, and a lot more people made it home happy and healthy, and that's what we want every day here in the Commonwealth. We have seen a steady decline over time, and let's keep it up. Let's get to the point where our workplaces are so safe that no one is ever injured. And that sounds like it may be a tough task, but I believe both our people and our employers are up for that challenge. Second piece of good news. The Justice and Public Safety Cabinet today is awarding more than $2 million in grant funding from the Federal Violence Against Women Act Stop Formula Grant Program to 28 agencies across our state. This federal funding allows our state to better support the insurmountable work provided by victim advocacy services, law enforcement agencies, and local units of governments to victims of violent crime. Funds are received from the Office on Violence Against Women, a component of the United States Department of Justice. The Office on Violence Against Women requires state administrating agencies allocate 25% for law enforcement, 25% for prosecutors, 30% for victim services, 5% for state and local courts, and 15% for discretionary distribution. The funding should be used for projects that serve or focus on adults and youth who are victims of domestic violence, dating violence, sexual assault, and stalking. Some of the programs funded by the grant include, and these are a bunch of great organizations that I had a chance to work with as Attorney General, and the work they do is so appreciated and here supported. Chrysalis House has been awarded $51,830 to continue funding a domestic violence therapist to ensure physical and emotional safety is established prior to treatment for women who have experienced intimate partner violence. Merriman House Domestic Crisis Center has been awarded $56,264 to increase safety of domestic violence survivors in the Purchase Area Development District by sustaining and improving collaboration efforts with local law enforcement and prosecution. The Nest Center for Women, Children, and Families has been awarded $116,780, which will allow it to continue to hire contract attorneys who will provide legal services at no charge to families obtaining an order of protection against their perpetrator in 18 different counties. We got to work together to stop the scourge that is domestic violence, to make sure that our people are safe. The long-term ramifications go far beyond just the partner. The physical and emotional scars that it leaves on our children is something we all ought to be committed to stopping. I believe in a world without domestic violence, without sexual abuse, without child abuse, and it should be attainable. It just takes all of us continuing to work every day, and these $2 million to organizations that earn the money are going to help us to get there. All right, one other piece of good news, which is our Kentucky State Police Angel Initiative. Today, we've announced the reopening of all Kentucky State Police post locations to the public to assist in the fight against the drug epidemic through their Angel Initiative. KSP's Angel Initiative is a proactive program designed to help people battle addiction and is available throughout the state. Anyone suffering from substance use disorder can visit a KSP post to be paired with a local officer who will assist them locating an appropriate treatment program. KSP launched the Angel Initiative in 2016. This is done by the previous administration through funding from the Kentucky Office of Drug Control Policy. I committed when I became governor, we'd do the right things and the right programs we build on. We wouldn't simply eliminate things or take action out of spite, and we've lived up to that promise. The Angel Initiative was a good initiative created by our last commissioner of the state police and by our last governor. Reopening it to the public is the right thing to do, and it's going to help people. KSP posts are open to the public Monday through Friday, 8 a.m. to 4:30 p.m., and COVID-19 guidelines must be followed. In addition to seeking treatment, individuals may go to any KSP post to safely dispose of any drugs or contraband they may have in their possession without threat of arrest. One more program we can use to help those who are suffering. So, that's all good news. Aside from what we deal with every day in the pandemic, there are lots of beacons of light out there, lots of people continuing to do good work, even in challenging circumstances. And there's lots of people doing good work in working to defeat this virus. Our vaccination efforts right now are exciting to see. You walk into one of our vaccination centers and you see a workforce that is inspired and is moving. You see people clearly walking around with purpose. You see faith in action in protecting other people. And you see people who've worked long shifts who are still smiling when that next person sits down because they're going to get their vaccine. We got a short video here that recaps yesterday's opening of our first regional vaccination site at the Kentucky Horse Park outside of Lexington and in Scott County. Take a look. It's pretty special. This is an exciting day for Kentucky. Through this new and growing partnership with Kroger Health, we will be able to vaccinate more Kentuckians as we receive more supply from the federal government. We are here inside the Kentucky Horse Park's All-Tech Arena in Lexington, where Kroger Health is launching the first regional vaccination site in the state. Across the Commonwealth, we are seeing efficiency pick up every single week. We are getting better and better at vaccinating people, which means for every Kentuckian, your time is coming sooner rather than later. The last 4 weeks, we've vaccinated more people than we've received doses from the federal government, meaning our only limitation at this point is supply, supply, and supply. But we can't simply sit back. We have to continue to grow our capacity. So when we have those additional vaccines, when the manufacturing picks up, when we have a flood of these life-saving shots of hope, that we are ready to get them out there and get them in people's arms as quickly as humanly possible. So let's continue to mask up. Let's continue to engage in social distancing. And when it's your turn and your time, let's roll up our sleeves and get this shot of hope. The individual you saw getting vaccinated there is one of our veterans. He has several health conditions, but wanted to step up and to be an example. We were all excited. We were all moved to see him get that vaccine. On vaccines today, we've got Dr. Stack. He's going to talk through how we're going to change our reporting, what you see online each and every day, to be a better indicator of how quickly we are getting the vaccine to new people. Because that's really what we want to focus on. Some look at doses out there, but when you get a second dose, it's got to go to a specific person. What we are focused on is how quickly we can get people that first part of their vaccination as efficiency. Now, I will remind you that we get these doses primarily on Tuesday-ish, late Monday, early Tuesday. So Tuesday, Wednesday, there's always going to be the biggest difference between our supply and how many people we vaccinated. But what you'll see from the reporting is by the time we get through that next Monday, 7 days after it, we're vaccinating more people every week of the past 4 weeks than we get supply. We're not going to be able to do that much longer. It's from extra from the first couple of weeks as we were ramping up, and that is very quickly being used up. Thankfully, we're going to receive, or we're now receiving about 22% more vaccine. This will be that first week. This next week will be the first week we reach that full increase since the new administration took over in Washington. Dr. Stack.
I'm sorry about that. Can you hear me now? You can all relate to this. This is a video conference world. I had 3 screens open and I couldn't get to it. So, Governor, thank you very much. I have two topics that the governor would like me to speak about tonight. Can you show the slide, please, for the new vaccine reporting? And then I'll walk us through that. So, on our website, we're going to change, and this should be update tonight, we're going to change how we report the vaccines that are administered. Remember, the single most important metric is how many people have been vaccinated, how many unique people have been vaccinated, because those are the persons who are on the road to protection from the vaccine. So what you see here is we will begin reporting and updating on a daily basis how many unique people have been vaccinated in Kentucky. That we will show next to the total number of doses, first doses of vaccine allocated to the state, and then you'll see a utilization percentage there. So the goal here is to show you, for all the vaccine we receive, what percent has been administered as a first dose to Kentuckians. Now, the other way to do this is to show all the doses, which include first dose and second dose, but we're committed to giving the second dose to everyone who gets the first dose. That should happen as a matter of routine course. So the most important metric is who has started this journey and received a first dose, which means they will be part of a two-dose immunization program. And when they complete that, they'll have the full benefit of the protection from the vaccine. And remember, if the third vaccine gets approved, if the Johnson & Johnson vaccine gets approved, and we're all cautiously hopeful that will happen later this month, that is only a one-dose vaccine. So again, in this paradigm, that will be the metric that matters the most, is how many people have received their first dose and therefore are on the path towards protective immunity from this disease. So in this top chart, you can see we've broken down the state program. Those are all the allocations that came to us at the state level, and then we distributed out or allocated out to hospitals and local health departments predominantly to administer to Kentuckians. There's also the federal long-term care program, and so that's listed here as the LTCF program. That was the partnership between the federal government and CVS and Walgreens to vaccinate licensed long-term care facilities and assisted living facilities. Now, in this, you'll see 80,925 first doses. We had recaptured 13 trays of Pfizer, about 12,675 doses, back to the state program and reallocated it. And you'll see the remaining doses in that program. They are working to do their second doses and will go back for a third visit to finish up all of those nursing homes. And then they will use the remaining inventory to reach other populations and use up all of that. So eventually that will reach 100%. And then it will all be the state program going forward. You can also see in the lower table there that we will report to you on a week-by-week basis how many new vaccines we were allocated and how many unique persons were immunized that week. And the governor has already drawn attention to this. If you look down there at the week of January 12th, you can see we immunized 143% relative to the first doses. What that means is that backlog, that inventory that we did not use the first few weeks of the program in December, we used up very quickly once we swung into increased productivity in the month of January. Remember, I've said for a while, December was always going to be a challenge for a number of reasons. January was about bringing order to disorder, and now February is moving solidly into consistent, effective production and administration of vaccine and building a system that gives you confidence that you can sign up and get some clarity about when you may be able to be vaccinated and then have certainty you will be vaccinated in a phased manner, which is what is necessary because of the quantities of vaccine we receive. Please remember, even though you hear that the quantities have been increased and the federal government said 16% last week, and an additional 5% this week. Those are wonderful developments to have more vaccine. However, the doses we're getting are still 68,000 or so doses a week. It's going to take a while to reach everyone who wants to be immunized. And we have plenty of stories now when health departments or vaccine sites turn on their scheduling. We find that, for example, in one of the regions, in the first hour that their phone lines were open, they had 51,000 phone calls trying to schedule for the 700 doses they were given. In the first 2.5 hours, their phone lines were open. 110,000 phone calls came in to try to access that 700 vaccines. So please, I know when you go to these sites, you make the phone calls, it feels like you're not able to get through. It's probably accurate for many of you. It's because we're only getting so much vaccine and the demand is so great. So please know they are vaccinating. They're using everything they're getting as quickly as they can. It's a matter of needing more vaccine to fulfill the demand right now, which is very large. And then I hope is those who are maybe hesitant to receive the vaccine see how effective it is and how the others tolerate the vaccine so well that other people will also want to follow along in the months ahead. Last topic I want to talk about. Can you show the Super Bowl slides, please? There's a small sporting event happening this weekend. The Chiefs and the Bucks will be playing with each other on the football field. While you enjoy that game, for those of you who will enjoy it, I think James or Scotty, if we could show or Jim, the Super Bowl slides, if you have one of those. I need to ask you, please, 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 this is just like any other holiday or social event. You have to practice social distancing. You have to wear your masks, please. When people get together in private residences in close proximity, that is one of the single most effective ways to spread this disease. We can't afford to have the disease spread now. with these mutations and these variants, every time we allow it to infect more people, it gives the virus the opportunity to mutate. It gives the virus the opportunity to learn how to defeat the antibodies that our bodies are forming based on the vaccines or the natural infection. We just can't afford to have that. It endangers us all and could undermine the success we're also optimistic we're going to see in the months ahead as more people get vaccinated. So please don't hold any large gatherings. Remember, the current guideline was 2 households max and 8 people or less. That was the current recommendation for the recent holidays, and that still holds true now. It's good advice, and I'd ask you to please follow it. 6 feet of distance or more between people. Wear your masks at all times. It's difficult when you have parties because people eat and drink and you take your mask off, and that's exactly what makes the infection easily spread. Please don't do that. Have virtual Super Bowl parties. Enjoy the Super Bowl in the privacy of your own home. We're hopefully getting to the light at the end of the tunnel for this pandemic. But if we take our eye off the ball, we can have more super spreader events and have more problems with more of these mutations and more spread of the disease. So enjoy the Super Bowl this weekend. I'm not going to tell you who I would prefer to win. You can have your own favorites in that, but enjoy the game and do it safely. And please, there's a lot of wonderful stories out there. What I hear from folks going to these vaccine sites, there are smiles, there is clear, just unbridled happiness in a way perhaps people haven't seen in a while, because I think people feel empowered. They feel like they're able to take action other than feel like they're a passive victim of this disease, and that they're taking a positive step to bring it to an end. That's what we want to celebrate on and focus on, is the optimism, the hope, the caring, and the kindness, to all the good things about humanity. We could focus on all the negative sides too, but ultimately that doesn't help advance our cause, and it doesn't help us rally together as a state and as a community. So please be good to each other, be kind, and we're working as hard as we can to get you vaccinated, and we'll do so as quickly as the vaccine quantities allow us. Governor, back to you. Thank you.
Thanks to Dr. Stack, and everybody tune in tomorrow, where we'll be announcing additional regional centers across Kentucky, building out our map as we go. We'll also be talking about local health departments, all of which are going to be getting a consistent supply for at least the next 3 weeks, though that supply, remember, is limited, and it's going to be dwarfed by the amount of calls and interest. Again, that is a good thing. It means that we don't have the level of vaccine hesitancy we were worried about. We do have it in certain populations, and we're going to work on that as we go in real time. Today's COVID numbers, we have 2,592 new cases. That is about 100 cases more than this time last week, but significantly less than the 2 weeks before. Again, that is positive, and that we have significantly less virus than 3 weeks ago. And we hope that this will be the first time by the end of this week that we have had 4 straight weeks, 1 month of declining cases. Right now, it looks possible. At the very worst, we think it will be close to what we had last week. Our hospitalization, ICU, and ventilator numbers are all really stable too. One's up 5, one's down 5. But again, we were able to take the steps we needed to at a time when our healthcare capacity could have been overrun, like happened in so many other states. We avoided that, and now we have seen a decrease. Our positivity rate down again to 8.53%. Shows you that this is real. It's not just a result of how many tests there are. We're seeing a decrease in the virus. We only have 106 red counties right now. That's the fewest we've had in a while. We obviously need to decrease that. New cases by county, we're looking at 424 in Jefferson, 152 in Fayette, 134 in Kenton, 117 in Boone, 107 in Davis. For Northern Kentucky, Campbell with 87. Again, watch tomorrow. Help's going to be on the way. But the tough part about our days right now is the number of deaths. January was rough. It was our worst month, and February is going to be tough too. Today we're announcing 51 new deaths related to COVID-19. 7 are individuals 60 years or younger. So today's report includes a 59-year-old woman from Adair, a 63-year-old woman from Ballard, an 85-year-old woman from Bell, a 29-year-old woman from Boone, a 79-year-old man from Boone, 82-year-old woman from Boyle, 93-year-old man from Boyle, 93-year-old man from Breathitt, 2 men from Callaway County, both age 72, 2 men from Campbell County, ages 51 and 82, 87-year-old woman from Carter, 60-year-old man from Casey. Fayette County lost a 75-year-old woman and a 53-year-old man and an 86-year-old man. We lost a 90-year-old woman in Fleming County, a 68 and a 94-year-old man in Franklin County, 53 and a 62-year-old man from Gallatin County, 3 individuals from Hardin, 2 women ages 85 and 88, and a man 81, 89-year-old man from Hart, 2 women from Hopkins County, ages 69 and 86. In Jefferson County, 2 women, ages 80 and 81, and 3 men, ages 80, 96, and 100. 79-year-old woman from Kenton, 77-year-old woman from Laurel. 3 individuals from McCracken, a 54-year-old woman, a 65-year-old man, and a 69-year-old man. A 63-year-old woman from Marshall County and a 77-year-old woman from that county. In Meade County, a 71 and an 80-year-old man. In Mercer County, a 64-year-old woman. In Montgomery, a 53-year-old man. In Nicholas, a 75-year-old man. 90-year-old woman in Ohio, 88-year-old man in Trigg, 93-year-old man in Washington County, 88-year-old man in Wayne, and we lost 2 individuals from Whitley, 87-year-old woman and an 89-year-old man. And a friend of mine lost his father this morning. And messages I've exchanged with him, please remember each of these come with heartbreak, devastating loss. We're experiencing so much of it. So please, let's not surrender now. Let's not do silly things that result in more people like my friend losing their dad, and he's about the 10th individual I know that's lost a parent during this crisis. We claim to be good people. We claim to be people of faith. Let's make sure we live those values and live that faith by protecting each other and not doing the silly things, whether it's here in Frankfurt or elsewhere, that put people at risk. We are in the bottom 10 in the entire country, which is where we want to be on deaths per capita. Means we've been one of the 10 most successful states about protecting our people. Let's not fumble at this late stage. Let's make sure we continue to do what it takes to protect our people through the end of this virus to the point where we defeat it. Long-term care, if there is a positive in our deaths, which are too high, it's that a smaller and smaller share are long-term care residents. That tells me that our vaccinations are working in protecting our most vulnerable. That also gives me some hope that our numbers are going to change significantly as we move forward. So on active cases, 28 new residents, 15 new staff, 12 new deaths attributable to long-term care. These increases have been significantly less than what we have seen in the past. All right, I want to talk just for a minute about schools. We are on track to become the fastest state to vaccinate our teachers. And that means that there is going to be an expectation and encouragement to get our classrooms open in some form based on the conditions in the community and the physical plant of our schools. Now, most of the state is already back in some form. This should provide additional opportunity to provide more opportunity for our kids. But I want to be clear because the CDC is being thrown around saying it's safe to reopen schools. Well, we're on a path to open them safely, but I want to make sure that each of you know what the CDC is actually saying. And this is from a call directly with governors. So they say they want to get schools reopened based on a couple of different points. Can you put that up? First, density control. So I went to a high school built in the 1970s with 2,000 students in Lexington. Certainly, that is a very different setup than other schools have. That may mean that the in-person opportunity there is a little bit different. Remember, we need to be able to create the 6 feet in as many circumstances as possible. We cannot have crowded hallways. Second piece is they say universal masking, no exceptions all day long. Third thing they say is proper ventilation. Again, that is different depending on the age of our facilities. And finally, they say every community has a role to play too. In fact, they talk about if a location is struggling to get their school open, the CDC recommends that restaurants and bars and gyms are all closed. Now, we're not making that recommendation, but that is the CDC's position. That's what's in their documents. That's what's in their guidance, which I think our House has tried to pass into law. So we're going to be working with KDE. We're going to be working with others through the end of this week. We want to be able to provide clear guidance and instruction about once we reach March 1st and beyond, about where we believe our schools can be, many of which are already there, to have hopefully a really great last 3 or so months where our kids get as much in-classroom experience as possible. Now remember, I'll put this out there, one size can't fit all. Different districts have different challenges, and we need to be understanding of that. We also need to be understanding that we will always need, through the end of this year, a virtual option for students whose parents choose it. We have immunocompromised students, we have immunocompromised parents. We have to have that virtual option that doesn't harm a student's academic standing so that there is real choice. We also have to continue to have the reporting that we have every day online. I mean, last week we had that reporting and it showed about 6,000 quarantined students, but you can break it down by school so each parent can ensure that they are getting the very best data that they can. Remember, my kids go to these schools too. So when we have our guidance out, our recommendations, it'll provide additional flexibility for our schools that are out there in what I believe would be a safe way for my kids and their teachers, who I appreciate so much, and everybody else that works in that building. We're going to have more on that next week, but I want you all to know that we are working. And because of the vaccinations, I think we're going to have more flexibility to do more than other states while the people in the building are safe and watching our educators get the vaccines. Every one of them said, this is going to help me get back in the classroom with the students, and we're going to work on making that happen. All right, with that, I'm going to turn it over to Secretary Brown, who is going to give an update on our corrections institutions and where we are on the COVID outbreaks in them.
Thank you, Governor. Had a flashback to about 10 months ago when we came to talk about our first outbreaks in a penal institution down at Green River. And at that time, it seemed like 200 or 300 cases was enormous, and we didn't know where it was going to go. And over those 10 months, I can't say enough about the men and women in the correction system and the inmates themselves who've tried to battle this as we've gone along. I thought today I'd give you a quick update, but I wanted to, as always, try to put it in context with some month over month and where we were at the end of the year. So James, if you would show up the numbers for where we were on December 30th. All right, this was December 30th, so it can effectively represent where we were at the end of the calendar year. some 10 months since the Green River situation. And as you can see, I want you to pay attention to the active and the total cases, because the active represent those who have it now, and then it shows how, when you juxtapose that against the total cases, how much recovery there's been. One statistic that is not up there that I have to mention is that at the end of the year, we had 34 inmate deaths and 4 staff deaths. So you can see that at the end of the year, we had 900 active inmates and a little over 4,000 total active inmates. When we go to the next date, which is January 20th, some 3 weeks later, you can see much as the states and a dramatic increase. When you look at the inmate cases, you can see that they went up by 1,300. And while it's not in that column, we also had 8 additional deaths during that time frame, and an additional death amongst the staff. This mirrored what was going on out in the rest of the state. This is the post-holiday community spread that had hit many of our institutions, and in fact had hit some of our ones which had been most had avoided it, which has included our what amounted to our long-term care facility at Kentucky State Reformatory, where some of our most vulnerable inmates were, and that jumped the death rate. In fact, 28 of what you'll see is a total of 48 inmate deaths came from the Kentucky State Reformatory. But much as we've seen with all of the efforts, we've made a lot of progress in just a short period of time. James, if you look now at where we are as of today, you'll see that there has been a decrease in staff active cases by 114 and a decrease in inmate active cases by 2,000 in just these last couple of weeks, indicating that even though we saw that enormous spike, that the efforts we've taken by being able to get to these folks quickly and administer care, we've been able to see a dramatic recovery rate. And we only had an increase of 74 staff cases during those last couple of weeks and 288 inmate cases. And again, 1 additional death, taking our death total to 43. As of today, 7 of our 14 facilities are free, no active cases whatsoever. And our largest outbreaks have been at EKCC, Eastern Kentucky, and Rotorua. We have 8 hospitalized and only 2 in the ICU. And we'll continue our efforts, and hopefully all these active numbers will continue to drop. Thank you, Governor.
All right, we will open up for questions. I've got a number of written ones, and we got a number of people on the line. We have been asked what the extra 5% amounts to in vaccines that we're getting. It's about 2,000. Next week will be the first time we get those. So we're working on the allocation of those now. What made the state change their requirements to make sure only Kentucky residents are receiving the vaccine? We had people who lived and worked in other states coming over and trying to get in priority groups in our state that they didn't qualify for in their state. And we're allocated vaccines based on Kentucky residents, and the other state is allocated for their own. So we're just trying to make sure that everybody goes where they're supposed to, and we don't end up with too little for Kentuckians because of vaccinating individuals whose vaccine is sent to a different state. Do I agree with the guidance of the CDC director that vaccinating teachers isn't a prerequisite for returning to class? Remember, there are all those other bullet points that nobody talks about. Our vaccinating of teachers is going to make it a lot safer. Most all of our schools, with the exception of a couple school districts that have greater challenges, transportation, age of buildings, are already at least in a hybrid model. And so I believe that this is going to help those other 2 school districts to get to a meaningful version of in-class learning, March 1st or after, that again will be carefully deliberated, I'm sure, based on the physical plan of what they have and the circumstances that they face that many other districts do not. We will be open to changing Kentucky guidance. We are going to be working on that here in the next week. Certainly after everybody's received that second dose, which is just several weeks away. Yes, we are going to be strongly encouraging the more in-person instruction. I don't want to say a return because most students in most school districts are at least in a hybrid model. Western Kentucky Senate District 4 talking about regional vaccination sites. Remember, we are building out the map. County health departments there are going to get vaccine, but remember, for the next 3 weeks. But remember, we have to change different providers at different times based on populations that we are serving and based on the infrastructure that's needed at different times. We need people to avoid big gatherings on the Super Bowl, which is one other question. Okay, let's open it up to Chad Hedrick from WKYT. Chad, congratulations on your move.
Thank you, Governor. I want to ask about teachers and vaccinations. You know, coming from covering West Virginia, I know that the teachers there have been very adamant. You know, not all of them have been able to get access to the vaccine. They don't, feel comfortable with going back to in-person learning unless they have at least that first dose. So why has it been such a priority for you to make sure K through 12 teachers have that vaccine and we're able to get students back to class?
Well, what we heard around Kentucky was that people understood. They understood the dangers of this virus, and they didn't want to put those that work in our school buildings in danger, but they really wanted us to do everything we could to create a safe environment for everybody who works there to get our kids back in class for so many different reasons. And I've lived it. I've watched my kids be primarily virtual for a while now. This helps the most important amongst us, which are our children. We want to provide them a bright future. This helps our workforce that have been struggling with kids at home where they need supervision on virtual learning and also needing to go to work. This is something so important for long-term development of our kids and for our economy. At the same time, protecting people who need that protection. And we believe that we've done two things at the same time, which is prioritize our educators, but also those over 70. So I think we are going to be, again, the first state to get this done. This is a value education that we believe strongly in as an administration, but all across the Commonwealth. So we're excited that our educators are going to be protected, be able to be in the classroom. It's going to look different. Everybody's still going to have masks, be spread out. Some are still going to be on hybrid models if they can't reduce the density or spread out enough, I'm sure. But there's going to be a lot more opportunity for a local decision making that meets the conditions on the ground in each community. And I know everybody's looking forward to that. Kristen Shanahan from WDRB.
Good afternoon, Governor, and this might be for Dr. Stack to answer, but do you know what exactly has led to the downward trend in cases, the decrease in cases?
I'll give my answer, and then I'll let him give his. So we were in an escalation in certainly November. Do we have the stair stepper chart? An exponential increase that we were seeing across the country. We took active and aggressive steps, and they were tough steps. We closed in-person dining for 2 weeks. We made other changes out there, and that took sacrifice, but it worked. We saw our numbers going down and down and down. We did a pretty good job avoiding a Thanksgiving bump, but we did have a holiday bump from the next two, which saw the increase. Now we're decreasing from there. I think it was both stepping in and taking the measures, which we know worked, but then it's also post that holiday bump, people doing things right. More people wearing masks, and we're also seeing this trend nationally. But I think that exponential increase and the amount of life that we have lost has been another wake-up call in a tough 11 months that unfortunately we've needed some wake-up calls, but I think that's natural too. Let's get Dr. Stack and his opinion, expert opinion.
Thank you, Governor. Thank you. I don't know about that. I hope, but I think the governor said it right. See, remember, this is like exponential growth is a very difficult concept for us and our human heads to get around. Things start spiraling out of control in an alarmingly escalating rate. It's kind of like a nuclear bomb. If you were to see the mushroom clouds from the movies, when the explosion happens, the amount of energy released just expands massively. Well, when the pandemic, when the infection starts to get out of control and it starts escalating rapidly, it quickly gets out of control, and then you can't stop it. Once it gets past a certain point, you can't stop it until it sort of burns itself out. So when we took all those hard steps, and they were hard, when we took those steps as we went into the holidays, trying to keep people separate from each other, trying to minimize the rate of escalation, I think what we did, and I'm confident about this because we didn't do it once, we did it 3 times. We did it in the spring, the summer, and in the winter season. We were able to stop or interrupt that massive exponential climb that we had clearly started. Because we did that, when it finally reached its peak and crescendoed, we crescendoed at a stage that did not overwhelm the hospitals, that did not cause them to have to shut down entirely, to have to double book rooms with people, to have to radically expand their ratios of patients relative to staff, things that have happened in states all over the country. So we managed to keep the peak at a level that we were able to survive. Now, we survived it because healthcare workers, doctors and nurses and respiratory therapists and pharmacists and others did really, really good work. So if you have friends or family or people you know, please thank them. I mean, they've got their own psychological scars from seeing the number of people who have suffered and died from this. But because we took those steps, we stopped how high it climbed. And now, like others, we're seeing the backside where I think people are away from those holiday type gatherings. People are still adhering enough, although we need you to do better, adhering to the guidelines. And now as we're vaccinating more people, I think what we'll find is that the number of people going to hospitals hopefully will diminish. And hopefully that as the warmer weather comes in the spring and we enter the summer, we can get ourselves to a much better place where the immediacy of the threat starts to recede. Back to you, Governor.
Josh James from WUKY.
Thanks, Governor. This might be one for Dr. Stack as well. There's not currently an official national recommendation regarding double masking, but I wanted to get your take on that and whether that's something the state will begin promoting.
Let's go to Dr. Stack.
Thank you. I have to admit, I feel a little peril in answering this question about the double masking because it makes me think back to March and April last year. So again, the devil is in the details and nuance really matters. A barrier in front of your face and your nose, your mouth and your nose, and actually something in front of your eyes. So here's an example where wearing glasses is good to keep stuff from hitting you is important. One, it keeps you from spreading stuff to other people. And now we know with evidence, it actually does help stuff from coming to you. So the general rule of thumb, if one is good, 2 may be better. Well, yeah, if you wear 2 masks, you've increased the filtration in front of your mouth and your nose, and you have decreased the number of particles likely to get through those barriers into yourself or out of yourself to others. So theoretically, 2 masks may be better than 1 mask. But we've already told you you should wear, if you use a cloth mask, the best ones are 3-layer cloth masks. So there's usually an outer layer, an inner layer, and then something in the middle. Could be felt or something else in the middle there. So if you have a 3-layer mask, you instead of a single-layer mask, you're already sort of doing a bit of that. So I wish it were as simple as saying, yeah, wear 2 masks, but it's really not. The biggest, most important thing you can do is stay 6 or 8 feet away from everybody. And that plus a single cloth mask with multiple layers, you're probably pretty good. But no, I don't I'm not going to tell you that 2 is not better than 1, but 1 plus more than 6 feet of distance is probably still pretty good and what we need everybody to do all the time. Back to you, Governor.
Corinne Boyer from WEKU.
Governor. Will there be any other state resources like the Kentucky State Police's Angel Initiative that'll shift back to addressing the addiction crisis anytime soon?
I think you will see more and more, especially as we were able to vaccinate staff across the Commonwealth. I do want to point out, though, that those that work in recovery have still been doing it. And what is already such a difficult task that people take on to help others going through something most of us can't imagine how hard it is to defeat, have been out there doing it. They've just had to do it in different ways. And sometimes I think they think it's less effective ways. But yes, I think as you see us get, whether they're government workers or those who work in recovery centers, vaccinated, you will see more and more open and directly working on it. A lot of our state programs, almost all of them, have been continual. It's just been a change in how they have been administered. But the opioid crisis hadn't gone away. We'll see if it has gotten worse and how much worse it's gotten in the crisis. I think that in the pandemic, I think we can expect that with isolation and the rest that we may see a bump up, but we still got wonderful, amazing warriors out there fighting to get people better, even in the midst of this pandemic. And you meet folks that are in recovery who have now dedicated their lives to helping other people in recovery. And I mean, it's an incredible, special thing to see. Sometimes you see God in those interactions when they're bringing their experience to bear to help somebody else. Alex Akisto from the Lexington Herald Leader.
Hi, Governor. You mentioned a few weeks ago about CVS and Walgreens and how they had a surplus of doses that they won't need for residents and staff. Dr. Stack just mentioned that the state recaptured almost 13,000 of those. Just wondering where those doses were reallocated and whether CVS and Walgreens has more that the state plans to capture and reallocate. Secondly, because vaccine doses are so limited right now, people are signing up for appointments from different providers. And I'm just wondering whether that is creating a lag in the ability to get the vaccine for those providers who are going through those registrants.
So the 11,000 doses were reallocated throughout the state, primarily to places that could get them out quickly, but they went to a number of different places, including some that were sent to help the new regional center, the Horse Park, reopen. Those were Pfizer, so that we couldn't, the providers were at least somewhat limited by needing to have that deep refrigeration. People who are making appointments in multiple different places, I get why they're doing it. It could create problems if they actually get appointments booked as opposed to are on the waiting list. We're working on a technological solution for this. Part of the reason that people do this, which is natural, is they don't get an appointment booked. And if we can book appointments out longer, like right now we're working certainly with Kroger to try to book even 3 weeks out. And now that the federal government is guaranteeing a minimum for 3 weeks, that ought to help us. That's going to alleviate some of this. The original way that the federal government only told us on Tuesday what we would get the next Monday, and then we had to allocate that between Tuesday and Friday, which meant providers only knew Friday what they would have on Monday, didn't give us the ability to allay some of those concerns. And I hope we can get to a point where we can schedule out even longer. Because I know, especially once we hit 1C, I want people to think about this. With the numbers in 1C, depending on how much more vaccine we get, it could take 3 to 5 months to get through the million plus people there. And that's tough, especially if you're calling back and calling back and calling back. So if we can get to a point where we're comfortable enough to schedule people out even a month, I know that would give people a peace of mind, and they wouldn't be calling around in other places. But I don't begrudge people doing that at all right now. They're trying to protect themselves, and we got to understand when some of this occurs that it's a natural human reaction. And I all want to hug, for me, our parents again, and for my parents, their grandkids again. They'll walk right past me to those grandkids. Sarah Ladd from the Courier-Journal.
Yes, good afternoon. Thank you. So I know you said Monday you were looking to release demographic data on vaccine distribution Monday. I wanted to ask if there are any preliminary equity concerns, and if so, does the state have a plan or any plans to bring in official partners who could help bridge those potential disparities? And then quickly, secondly, I wanted to ask, has the state identified pharmacies in Kentucky that will get those direct shipments of doses from the federal government? Thanks so much.
So on the second question, the federal government chose them. We haven't had that opportunity. We are on a call with them tomorrow, so should be able to announce who they are tomorrow. We haven't directly talked to them yet, and so we'll need to confirm that, and then we'll be able to talk about that at this point. When we release data on Monday, we should expect that we will see at least something similar to what we're seeing in the entire rest of the United States, which means we need to be more intentional on equity. I think what we will see are a couple of issues. Number one, we need to be more intentional in our program, and we are working on doing that right now. Number two, that societal inequity in terms of percentage and diversity of the workforces that the CDC put in 1A and 1B are also an impact. And third, we got to continue to work on vaccine hesitancy, especially with our minority populations. We've been hard at work at that. We hired Doe Anderson at the state to have and help us with community conversations. They brought in businesses to help have those conversations within our minority communities. I participated myself in a number of those, and there have been others. We're also working to address vaccine hesitancy through community leaders, including a number of pastors who we have a vaccination program working with, who can then build confidence in their congregations. And we're going to continue to build on that. Now, on Monday, when we get this data as it comes in, we're going to be transparent. And then we're going to talk about how we address inequity in this program. And I think that we've got a track record for showing that when we're intentional, we can address inequity. I remember back in the summer when the disproportionate death, especially for our Black and African American communities, was at 16% of total deaths. That's double the percentage Black and African Americans make up of Kentucky's population. Today, it's back down to about 8.5%. That was a concentrated effort to get people signed up for health care. That was a concentrated effort to provide education, to bring in community leaders, and it was a combined effort with our healthcare community to get out in underserved communities. So we're going to have work to do, but we're committed to doing it. It's an absolute requirement in our vaccine distribution program here in Kentucky. So we'll have more on that on Monday, but you'll probably hear me say a lot of the same things at that point. Tom Latek from Kentucky Today.
Hello, Governor. Good afternoon to you. Looking at that stair-stepper chart, hard to say, with a rather significant decline over the last few weeks, is there any thought being given to easing some of the capacity restrictions at places like restaurants and bars and different places along those lines? Or are you waiting to see if there's a post-Super Bowl bump, if you will?
We're not waiting right now on the post-Super Bowl bump. What we're waiting is to continue to see the trends go the same way, because our numbers are still really high, and our positivity rate, we're really happy that it's below 10 or 12 where it reached, but it's still in the 8s. We're headed in the right direction. If we continue to do that, then yes, we'll be able to look at all of those things. We're not going to keep something in place just because it's in place. If things get better and if we continue to see better masking, then yes, absolutely. We're always willing to look at our approach when we are doing better as a state. Because listen, I haven't wanted to make any of the orders that I've done. I mean, you run for this office in many ways a popularity contest of people voting, and the steps that we've had to take to fight COVID aren't popular, but they're the right thing to do, and people's lives are on the line. It made me say early on that I was done with politics. We were just going to do this right, and the chips would fall where they fell. That if I believed that we'd saved lives, and compared to other states, we have certainly saved lives, that I could put my head down on my pillow at night and hopefully sleep through the full night for once in roughly 11 months. So I can't wait until we don't have to have any of these at all. I can't wait. And my hope is that I won't face, and we won't face as a people, anything else like this when I'm governor. I can't wait to not have to use any of these emergency powers. I can't wait to focus on economic development every day because we've got some really exciting possibilities. I can't wait to continue our work in education to make sure every child gets a world-class education. I can't wait to build on what we've done in healthcare during this pandemic. I ran because I wanted to build a bigger, brighter future for my kids. And most of my governorship is about making sure their and other people's grandparents and parents stay alive. So I can't wait until we can ease these restrictions. And certainly as it looks safer and safer to do so, we will. John Charlton from WHAS.
Thanks, Governor. Hope you're having a good day. Last week, you talked a lot about the 1099-Gs and the email sent out for people to, email the state about their issues. Do you have any sense on how many emails you guys have been getting from claimants? And a second question is, with the COVID-19 vaccine, is there any thought that maybe an essential worker would be an unemployment worker so that we could get more in-person appointments?
Yes. Yes is the other piece, and that will allow us to open up for in-person appointments. We had multiple scares here that would have wiped out our entire workforce there, causing us to go virtually. We'll get you the number on the 1099s. It's breaking down into a couple of different things. A large part of it are misunderstandings of how the number is calculated that's on there versus what people saw come on to their cards or in their bank accounts. Part of it is misunderstanding because of the way the $600 extra and the $400 came in versus how traditional unemployment works. And then there is a portion of them that are based on fraud, and we're getting those emails. And then there's a portion that we're probably going to need to do some work to correct. And so that kind of breaks down all of it. The group where we're going to need to work to correct it, we think is much smaller than the total folks who are getting these and who have concerns. We believe the vast majority of it is just the complexity and understanding something we've never gotten before. And the way that they did the $600 extra and the $400 extra each time further complicated what it was. Certainly the group that we need to work on are folks that qualified for unemployment, didn't necessarily get on and claim it for the first time, but it was a time when dollars were already going directly onto the cards. So we're going to be able to work that out. Amy is going to be here tomorrow to provide a UI update and fix whatever mistakes I made in that answer. Melissa Patrick from Kentucky Health News.
Hi, Governor. Well, Senator Robbie Mills today spoke to the very frustrations that you have mentioned of his constituents in Hopkins and Daviess County, saying there's just no vaccines available. But he also said that they have a perception that Indiana is doing better than Kentucky, and that they're very frustrated by that. He also spoke to the need, what he perceived the need to be more and better communication about vaccine availability from your administration. So I'd just like for you to sort of speak to that perception that other states are doing better than us, and also to his call for better communication.
Well, we're a top 10 state for vaccinations. The last 4 weeks, we've vaccinated more people than we've received doses. And if you go over 100%, I think that's pretty good. I think in most statistics, we're ahead of Indiana, but I want Indiana to do well too. There are numerous areas in his district. We're working with hospitals in Owensboro that have had vaccine during this entire time. We've given the first round of vaccines to every one of the K through 12 employees that wanted it, all the hospital workers and folks in 1A, all the first responders. So there's been a lot of vaccine out there. The health departments are going to have certain amounts for the next 3 weeks, and we continue to open regional centers and regional centers across the Commonwealth and fill in the map. People are going to be frustrated who can't get it right now. And we've been communicating about supply every day. You all have seen it on our website. We show exactly how many doses we get in and how many go out. Their providers have their amount, which is public when they receive it, and they put it out. So we're getting it out as fast as we can. It's gone out, we believe, equitably across the state. In fact, in the beginning, rural Kentucky got more than urban Kentucky as we were directing it out towards healthcare workers. I think that there are multiple providers in the area that would say that they think that they are being treated fairly. But listen, unfortunately, a speech on the Senate or House floor right now is in the silly season. I don't think they're going to get up and say anything positive. It's unfortunate that that's where we are. But this is also a body that I hope will be more thoughtful moving forward on what they pass. We had to go to court today to challenge 3 bills. One, I'll give you an example, was House Bill 1. It basically said no more of the governor's executive orders, quote unquote, CDC guidance is now the law. But they didn't say which guidance. There are 174 CDC guidance documents. Now, I guess every business would have to look through all 174 of these, which multiple ones will apply to them, and try to figure out what they do or do not have to do. I mean, we can't defeat a vaccine with this. What should you do to keep people safe? This. We got to have clear, consistent rules, and that's what the Supreme Court said, just a couple months ago. So, whether or not people want to pull authority from me, let's be smart in how we address the virus and not say to our businesses, it's on you now. Here's all the paperwork. Todd Dykes from WLWT.
Okay, Governor. Wait for a second. On TV a moment ago, I hope if I'm repeating the question someone else has asked, please forgive me. But I'm curious on the unemployment front. Been talking to more people about their frustration with not being able to access a live voice when they're calling in. That apparently has changed over the last month or so. I'd speak to that if you don't mind, that frustration. People just want to talk to someone to try to understand where their claim is. And then also I'm curious about the economic damage, if there will, or how you would couch it. There's a recent study, the Century Foundation, I'm learning about this organization, $17 billion nationwide has been lost because of backlogged unemployment benefit payouts nationwide. Kentucky, I don't know what the dollar amount would be in the state, but that would mean if that holds, that dollars are not changing hands, businesses aren't receiving any of that. There's just the money flow is not there, which could be very damaging to the economy. Talk about those two things. A, the lack of what I'm hearing, people not being able to talk to a live person on the other end of the phone, and then just the money that's not flowing through if it's on backlog payments.
Right. So there's a balance on money not going out and us preventing fraudulent claims. We're seeing across America billions and billions and billions of dollars worth of fraudulent claims. So our goal is to get as many payments out, but we have to follow a process to ensure that we don't do what California did and pay out huge amounts of taxpayer dollars to those fraudulent claims. Now, unemployment dollars cycle through the economy really well. The extra $600 and $400 that were out there move through businesses. So yes, we want to make sure that every valid claim gets paid, get those dollars out. And I know people desperately need it. I think you're going to see us be able to clear a number of fraudulent claims out of our backlog. That will help us better focus on those real claims. People can go to the website of the Labor Cabinet, and what you need to do is sign up for an appointment, right? That's not calling, hoping to get somebody that doesn't have a set designated time for you. That is signing up to get 20, 30 minutes with an individual to try to work through your claim. Also, make sure that you put the right email on your claim. Make sure that you still have the same phone number. We are having issues with not being able to reach people at different times. And certainly we have a lot of claims where basic information hasn't been provided that is necessary, and there have been multiple outreaches, and we haven't seen those documents come back. Now, we think most of those are fraudulent, but to the extent that they are real, we want to get them the dollars. And to everybody out there that's still struggling to get your dollars, we're working really hard. You shouldn't have had to go through this. We should have done better. We got a computer system that's coding comes from before I was born, and that was put in place when I was in college. We do believe we're going to be able to get that upgraded here soon. Just about everywhere else in the country is dealing with the same thing, but that doesn't really matter if you're the person that's being impacted. So we'll continue to work to do better every day. All right, remember everybody, tomorrow we will have announcements on new regional vaccination centers. The light at the end of the tunnel is there. Make sure you take care of each other so that we can get there and get there safely. Thanks.